Hello everyone, Dr. Samina Mita here, naturopathic doctor, and today we're talking about miscarriages and recurrent miscarriages. Oftentimes, patients aren't treated for miscarriages unless they have more than three miscarriages. So today, what we're going to talk about is kind of the risk factors to look out for that could potentially mean that miscarriages are higher in specific cases, which is commonly what we do in naturopathic medicine. So I will be using miscarriages and recurrent miscarriages kind of interchangeably, but definitely we're going to talk a little bit about the causes of miscarriages. So that's number one thing we're going to talk about. We'll talk about lab work. That's really important for all these causes of miscarriages. And then also we'll talk about naturopathic approaches to treating different causes of miscarriages. All right, so let's get started. When we're talking about causes of miscarriages, one of the most important ones is genetic issues. So oftentimes we do see issues in the up to the first 12 weeks of pregnancy if there's a miscarriage. We're considering sperm and egg quality in this situation. So if there are any genetic issues in terms of replication as the embryo is replicating, it can be due to genetic causes, and these causes could be because of the quality of the egg and the sperm. So in terms of, how many genes does each egg and sperm have, and what's the quality of the egg and the sperm that allows it to properly divide and multiply. Another thing to consider here is male factor. So if there's any issues with the sperm in terms of any of the parameters on the sperm analysis, definitely need to be looking at that. But also DNA fragmentation. This is a test that's done to kind of see how much of the DNA in the head of the sperm is fragmented. And the more fragmented the DNA, the worse quality the sperm will be, and that can impact the ability to sustain a pregnancy. So that's one lab test for genetic causes. Another lab test is karyotyping and looking for a balanced translocation. So genetic causes are possible, and so really speaking to your healthcare provider about testing is really important. So the second thing is anatomical causes. So first thing is fibroids. These fibroids can be sitting inside the lining of the uterus and can impact implantation. So really important if you have painful periods to get assessed through ultrasound and sonohystogram to really get a clear picture of if there's any fibroids present and where they're located. Other areas they can be located are in the muscle of the uterine wall or the outside of the uterus. The second thing is polyps. So polyps are just an outgrowth of the uterine lining, and they usually sit in like a hanging type of form, and they can vary in size as well. Fibroids can also vary in size. So it's really important to kind of check and see if there's polyps, especially in the uterus, and looking to see where the polyps are and if it can also impact implantation depending on the size of the polyp. Oftentimes, one of the signs of a polyp could be there is spotting in between cycles. So definitely looking through transvaginal ultrasound. So that's when they insert the ultrasound probe into the vaginal canal and they're looking at the uterus and the ovaries in detail, and then also over the abdomen. Sonohystogram is when they will put a little bit of saline solution into the uterine cavity, and they'll look through ultrasound to make sure that the saline can actually get through the fallopian tubes, to make sure the fallopian tubes are also open. So blockage of the fallopian tubes can also be a cause of infertility. Not so much, in terms of miscarriages, but basically, that sonohystogram really gives a good visualization of the uterus and what's going on inside. All right, so the third thing is thrombotic causes. So this is where there's an imbalance between clotting factors that help us to coagulate blood. And so one of the causes of this is antiphospholipid antibody syndrome. And this is an increased tendency to form abnormal blood clots, which can lead to an impair in blood flow. So, when there is potential for antiphospholipid antibody syndrome, we're looking at anticardiolipin antibodies, lupus anticoagulant, glycoprotein, and potentially any antibodies like IgG or IgM. um, this is something to definitely look at, especially if you've had a miscarriage in the past. Okay, the fourth thing is autoimmune conditions. So this could be high thyroid antibodies, high ANA anti-nuclear antibodies, and also, but the biggest one we commonly see is thyroid antibodies. When we're thinking about the immune system and how it really impacts fertility and also recurrent miscarriages, the thing is, when a woman gets pregnant, we know there's a shift in their immune system to actually allow the body to accept the newborn fetus. And so when the body is trying to accept the baby, especially because the baby's DNA is different from the mother's, there's a huge shift in the immune system's response to allow for the accepting of this foreign body, I guess you could say, in the uterine cavity. So, one of the things we commonly see are high thyroid antibodies. This is commonly known as Hashimoto's thyroiditis, where we see high anti-thyroperoxidase and high anti-thyroglobulin. So, those are the two lab tests that are commonly run to find out if we have thyroid antibodies. We know that high thyroid antibodies are actually associated with recurrent pregnancy loss. And the presence of these antibodies can actually impact the immune system. And like I said, the immune system does kind of change when a pregnancy happens and implantation occurs. So the presence of thyroid antibodies can actually really impact the developing placenta, the endometrium, and the fetus. So that's one thing to get tested for immune-related autoimmune conditions. And then the second thing is vitamin D. So an hyperactivated immune system can actually really impact implantation. And research actually shows that recurrent pregnancy loss is actually associated with high prevalence of vitamin D deficiency. Research also shows that vitamin D deficiency, that people who have vitamin D deficiency who have had recurrent miscarriage loss also have an increased presence of immune markers like thyroid antibodies, anti-nuclear antibodies, antiphospholipid antibodies. So, really looking at vitamin D levels, especially to support the immune system's response, is to implantation is really important. Okay, so we've gone over genetic causes, anatomical causes, thrombotic causes, immune-related issues. Second to last is hormones, which is extremely important. So we often find when there's low estrogen, it can cause thinner lining. And when thinner lining happens in the uterine cavity, it can impact implantation. So really important cause to look into. High levels of insulin. So when we see insulin resistance, especially in women with PCOS or women who are overweight, higher levels of insulin can actually increase risk for miscarriage. High testosterone. So when we have high insulin, especially in PCOS, it can increase testosterone. And so that can also impact our ability to carry out pregnancy. Low progesterone is also a cause. So we're always looking 7 days post ovulation what does that progesterone look like, because that will tell us if the patient maybe needs a little bit of progesterone support through vaginal suppositories, and also if the luteal phase is a little bit shorter. So this is the after ovulation. We have 14 days until the period comes. So if this luteal phase is shorter than 14 days, there could be a luteal phase defect where we have lower progesterone, and so really checking the progesterone is important there. Oftentimes, if the luteal phase is a little bit shorter, it actually is an issue with the first half of the cycle. So working on the estrogen piece of the first half of the cycle is actually important, because what happens is as estrogen rises, the follicle is being built. And the follicle is what houses the egg. And so when the egg actually comes out of the follicle during ovulation, that follicle turns into a corpus luteum. So the quality of that follicle is really important, because what happens is once we create that corpus luteum is responsible for progesterone production. So really important to sustain a pregnancy. So we want to make sure we're creating the best quality follicle that houses the egg, so that we create the best quality corpus luteum to make a good amount of estrogen. Okay, so what else do we have here? Oh, high and low thyroid function. So looking at TSH, which is thyroid stimulating hormone, hyperthyroidism, and hypothyroidism, making sure there isn't any of those symptoms, especially in blood work, and also symptomology based on what the patient is experiencing, is very important to look at. And when we're testing for hormones, there's a certain way to test them. So oftentimes in fertility clinic, they'll start with day 3 testing. So that's the 3rd day of your cycle, meaning the first day of your cycle is the day that you first bleed, so full flow bleeding. On the 3rd day, they'll test FSH, follicle stimulating hormone. This stimulates the follicle to produce estrogen so that we can make a good quality follicle that houses the egg. LH, which is luteinizing hormone. Luteinizing hormone spikes just before ovulation, and once it spikes, 24 to 36 hours after that, we'll see the egg come out of the follicle. And then estrogen is really good to test in the beginning of the cycle to kind of see where we are at baseline. And then 7 days post-ovulation, so this is in the midpoint of the luteal phase, because I said the luteal phase is 14 days typically, we want to see what's going on with progesterone and to see if the patient has ovulated properly and if their progesterone levels are robust enough to really sustain a pregnancy, especially if maybe we think we have an idea that the corpus luteum isn't making a good amount of progesterone for them. So estrogen and progesterone in that second half of the cycle. Insulin, fasting insulin is really good to test. Typically, we don't want it past 100. If there's absolutely no insulin resistance, typically we'd see this around 50. And then testosterone, so really testing all markers of testosterone, free and total testosterone, androstenedione, and DHEAS. If the patient has signs and symptoms of high testosterone and PCOS, really important to be testing testosterone. And also, testosterone later on in life, just because testosterone can decline, we need a little bit of testosterone to actually create a nice quality follicle as well. But we don't want too much, like in PCOS, and we don't want too little, like when we're aging. So when we're reaching, ages of like 40, we do see testosterone kind of decline as well. And then just before I move on, signs and symptoms of high testosterone are things like acne, hirsutism, so excessive hair growth, and hair loss. So, if the patient has any of those signs and symptoms, definitely checking out testosterone is important. And then the thyroid, so TSH. The research actually says we want TSH around 2.5 or less than that. So even if the TSH is riding a little bit higher than that, because 2.5 is still within the normal limits, especially in the reference range here in Canada, if it's greater than 2.5, even getting medication, a little bit of Synthroid can be really helpful. And then last but not least, another cause is lifestyle. So obviously smoking and alcohol consumption can really be impactful here. And some would say, stress can be a huge component of just balancing of hormones. But there's not too much research on that from what I've seen. Okay, so those are the causes, and I went over all the labs that are kind of associated to that. So, last but not least, just like any these conditions have been associated with increased risk of miscarriage, so PCOS, endometriosis, and infections. So, taking a look at that too and getting assessed for that. Okay, so let's talk about naturopathic medicine. So, if there's any genetic issues, or we know that, egg quality isn't the best, just because maybe the patient has had IVF and they're not getting the good quality eggs that we want, or they've had a miscarriage in the past that's less than 12 weeks, or their AMH is a little bit low, or they're a little bit higher in age, we really want to support with antioxidants. And also, if there's any genetic issues, like really supporting lifestyle. So, smoking, no alcohol, and also no marijuana use, just because it can impact the quality of the egg and the sperm. When we talk about anatomical causes, so we talked about fibroids and polyps, we can help through naturopathic medicine with acupuncture, supporting the blood flow to the area, and also hormone balancing. So oftentimes when we have fibroids and we have polyps, it could maybe be due to higher levels of estrogen. So really just supporting the hormones there, and then also supporting blood flow to the reproductive organs. But it can be difficult to shrink fibroids and also polyps. So sometimes surgery is actually really recommended in this case, depending on the size, severity, and where they're located. All right. So in terms of thrombotic, causes, we talked about antiphospholipid antibody syndrome, and when it comes to blood clotting, we don't want the blood to be hypercoagulable, meaning that it like kind of binds up together. We want nice blood flow happening, so we look to find any anticoagulants that help with blood flow, and so baby aspirin could be an option, blood thinning herbs, and omega-3 fatty acids, fish oils. And then the immune system. So the immune system is so important, like I was talking about, in terms of really accepting the fetus, and also with implantation. So in naturopathic medicine, there's so many things we can do in terms of supporting the immune system, really investigating food sensitivities, supporting the immune system with vitamin D, selenium, zinc, antioxidants, and systemic enzymes. So really trying to figure out if there is an autoimmune, component to the case. How do we support the immune system by making sure digestion is working really well, especially because a lot of the immune system actually lives in the gut. And the last thing I forgot to mention is probiotics, which is really helpful for the immune system and then also for gut health. And then when it comes to hormone health, lots to consider here in naturopathic medicine, which is great. Oftentimes, if we're treating PCOS, it could be high testosterone, high insulin. So we're really working on the insulin resistance component, using dietary and lifestyle changes. We may be even using something like inositol to really help balance insulin levels, and help bring insulin levels to bay so that miscarriages aren't happening, which is really important. If there's low progesterone, we're using micronized bioidentical progesterone to help, that keep the progesterone levels high enough, especially if maybe the corpus luteum is kind of lacking that support, and also helping to balance that luteal phase, especially if the luteal phase is too short or actually too long. And then if there's low estrogen, that could be causing thinner lining, using acupuncture, using herbs to help build estrogen up, can be really helpful in this case as well. And also really supporting the thyroid. So if there's any issues in terms of hypothyroidism, difficulty losing weight, things like that that are associated with hypothyroidism, we have quite a few herbs, nutraceuticals, supplementation like selenium, zinc, working on stress management, so using adaptogens. These are botanicals that help us to adapt to stress, can be really helpful, especially in supporting the thyroid and the adrenal glands. So I hope this was helpful. It was a lot of information that I went through, and if you have any questions at all, please drop them in the comments below and I will make sure to respond to them. And if you ever require any additional support, I see patients in Ontario, Canada, so if you ever want to reach out to me, feel free to email me at info@saminamitha.com. Have a great day, everybody, and see you soon.